Sorry, Alicia. Anna is telling me that she can't get in the
Yeah.
meeting.
Wait, sorry, because I will admit everyone. So wait, okay. Sorry, because I will now admit everyone, so I will wait. Thank you for letting me know. Wait a second. Wait, one sec. Morning, Anna.
Good morning. Good morning, everyone.
So okay. I just fine. One sec. Okay. Okay, so I think we can start. Good morning, everyone. My name is Alicia Gavan, and I'm here speaking on behalf of the ERLAN, that is the European Association of Local and Regional Authorities for Lifelong Learning. We are organizing this webinar, the Care Sector Skills Analysis. That is the second webinar that we organize to understand a bit better what is happening in different sectors across European regions. I'm going just to say a few words on the housekeeping rules. You already read them on the chat, but just to repeat. So please make sure that your microphone is mute. Please rename yourself with your name, region, and also this when you take the floor. You can leave the camera on, but please know that we might take pictures for our social media. You can use the chat box or raise your hand to ask questions after the presentations. Our moderator will be passing the floor to you. And finally, we are recording this webinar and sharing it on our YouTube channel. And we will be sharing the presentations after the event. So now I will pass the floor to our working group leader, Oscar Parazon, who will be in charge of moderating this webinar. So Oscar, the floor is yours.
Thank you, Alicia. Good morning, everyone, and thank you for joining us today once again on this interesting webinars that we're carrying out, as Alicia was saying, to see what the situation is like in different sectors all over Europe. Today, we're going to be talking about the care sector. I am from the Regional Ministry of Education. at the government of Catalonia, and my colleague Anna, who's here as well, will be also from the Regional Ministry of Education, will be checking your questions on the chat. So whenever you have one, please feel free to use the chat and ask your questions, and then we'll go on to them afterwards. And well, it's quite relevant to be talking about the care sector today in April, because just a few days ago, on the 7th of April, we celebrated the World Health Day. Can we, sorry, Alicia, can we go back to the previous slide? Yeah, so yes, here you have a quick outlook on the agenda. As usual, the structure of the webinar will be the usual one. We're going to have like a first introductory presentation by a European expert, and then the second part will be different interventions by our colleagues from different European regions. And then obviously at the end, we're going to have a question and answer session for you to ask any questions or make your own comments. Right, so after having looked at the agenda, we can go on to the next slide, please. And then, yes, to introduce this topic, or today's topic, well, we have to say that the care sector is a very important sector in Europe, in every country, because as you can see,
Oscar, you have muted yourself.
sorry, yeah. Sorry about that. Thank God I wasn't saying anything important. Okay, right. So no, I was just saying that yes, that the care sector is a very important one in Europe, and because well, not only because obviously there's a big demand for these workers, and that implies that there are a lot of people working in the sector. We can think of direct jobs, like obviously people directly in contact with ill people or with elderly people, for example, or even, well, obviously babies as well, and also indirect jobs that are the ones that, for example, have to do with the cooking and the cleaning. So here you have a few data about how many people work in the care sector. And well, also you can see that the European Commission is aware of the importance of this sector and has launched different initiatives related to the sector. Here you have a few of them. And before giving the floor to our first speaker, I'd like to recommend a film. Okay, it's a British film called Help. This film was released in 2021, and the film depicts the story of a health assistant in a care home in Liverpool when the COVID-19 hit the UK. And I suppose we don't have to remember how dramatic the situation was. In the case of Spain and Catalonia, especially in the areas of care homes for elderly people, it was very dramatic. We had a lot of deaths. I don't know if that was the same in your countries, but I'm already advancing one of the questions I'm going to be asking all the speakers today, so you can start thinking about your answers. Because usually what we do in these webinars is think about the future. So what are the challenges, or how can we work on the challenges to, you know, to make things better in the future? So obviously COVID-19, fortunately, is something that it's over, but obviously experts are talking about possible new pandemics. So my question would be for you, if you like to answer this question after your interventions, your presentations, is: are your countries or your regions prepared for the next pandemic from what we learned from the COVID-19 pandemic? So that's my question for you later on, if you'd like to answer it. And now we're going to listen to our first speaker. His name is Jiri Branca. He's an expert in labor market and intelligence and skill at Cedefop. You have some information about him, but probably he'll like to introduce himself much better than I could do. And so we'll give the floor to Giri. Giri, dobre rano, kalimera. Thank you for joining us. And I'm sure your presentation is going to be really interesting. Thank you.
Thank you very much, Oscar. Very kind of you, and I appreciate that you found time to greet me in my native language, but also in the language in the country where I now live, which is Greece. Let me share my screen then. So now you see nothing, but soon you will see the presentation. Yeah. So I come from CDFOP. Oscar, you introduced me really nicely, so I will not say more about myself, but I can say a few words about the organization where I work. I suppose that most of you know CDFOP, but if there are some people who didn't hear about CDFOP before, so we are the EU Vocational Education and Training Agency, which basically means that we care for 3 topics. First is how people develop and certify their skills, and so we are interested in the training, in the outcomes of people's learning, about qualifications, and recently about this hot upcoming trend of micro-credentials, and we also care about upskilling low-skilled adults. Then the second part of CDFOP work is about how people move from learning environments to work, where we focus on apprenticeships and career guidance. And then the last part, important part, is that how people's skills matched with jobs, tasks, and needs. And this is where I work. So it is about skill needs, about looking into the future, looking at foresight and forecast of skills. And we present it in packages that we call skills intelligence. Enough about CDFOP. Just to tell you that what I will be presenting to you is based on 4 sources of information. There's information from our skills forecast, which looks into the employment trends up until 2035. Then there is some data from our analysis of online job advertisements, and we have been doing a large survey on skills among employees, which we call European Skills and Job Survey. And there is also some employment data coming from official statistics via Eurostat. What is a bit of a challenge, and I will have to tell it to you before I start sharing with you the outcomes of our research work, is that there is a difference between care and long-term care. So basically, European Union is mostly interested in the long-term care sector, because this is where the challenge is perceived as most dramatic, and this basically involves only part of what we define as a care sector in general. So you have this residential nursing care activities and residential care activities for elderly and disabled, and then the last part is the social work activities without accommodation, which you provide in people's homes. Care sector is basically much wider, so it also includes some other activities, for example, activities for mental retardation, mental health and substance abuse, child daycare activities, and so on. And the problem with the CDFOP data and with the data from Eurostat also, is that often you cannot go into such level of detail. So while most of my data that I'll be presenting is about the care sector, I will try to give as much detail as possible about the long-term care trends. And let's go. I think it's enough about the methodology. So something that is probably not very surprising. So the aging is a major challenge for the EU. Just to illustrate that, in 2001, the average age was about 38 years. Now is 44 and is predicted to grow until 48 by 2050. And what is, from our perspective, most important is that when you look at the share of people who work in care sector across countries, you see this declining trend, that you have very strong employment of care workers in countries like Norway or Denmark or Finland, Netherlands, and so on. And then it goes down, and in majority of Southern and Eastern European countries, these workers represent much lower share on total employment. But when you compare it with the kind of expected need for these workers, which we measure as a share of population age 65 and plus, which are the pink dots, So these are the people potentially in need. You see that it's basically similar across all countries. So this indicates then while in some countries in Northern and Western Europe, we seem to have a good coverage of let's say care services to potential needs. In most other countries, it is not the case. And unfortunately, the situation that is already now not very good is probably going to get worse. So in the decade between 2011 and 21, the care sector increased employment by some 20%, which was about 1.5 million new jobs. And but again, following on the graph that I was sharing before, you see that the care availability depends on economic strength and, let's say, general approach to welfare. So you have these great differences between Western and Northern and Southern and Eastern Europe. And unfortunately, the demand for care service will grow significantly. CEREFOP still predicts that there will be some new jobs created, so the capacity of the care sector will increase. But unfortunately, this is an increase that we forecast is just an additional 7% of what is the current employment, but the number of people age 65 will grow by almost 1/4. So comparing on these two numbers, you see that the availability and the need for the care services are kind of going in opposite direction, and this is the major challenge that we see for the future. When it comes for the drivers of change for the care sector, we did some analysis on what is happening. So of course you have the demographics. So population aging affects overall demand for change and also types of needed support. We see also that the conditions that are mostly observed in old age will become more frequent because we also have longer life, and so the more frequent episodes and longer time that people will be in need for the services. Then we have the socioeconomic changes. So we see as one of the major trends is this shifting of responsibility for care from informal to formal professionals, and the preferences of the elderly and disabled people changing towards home care. And because of the skill gaps and skill shortages that we see, there is obvious increasing importance of foreign workers, which brings possible language and cultural challenges. And very soon there will be a new report published by DG Home about prospects and needs for migrant workers to work in the long-term care sector, which we also contributed to. Of course, digital transition I have to mention. So we have these new technologies that kind of promise to contribute to healthy aging and to more efficient provision of care, but lack of skills hampers effective introduction of technological advancements in the sector. Finally, you have this kind of legislative and organizational factors which will affect workforce size, characteristic and skill needs, and this will differ country by country. When looking at the employment in the care sector, you see this graph that describes the most important occupations in the care sector, and you see 3 bars, one showing the employment of these people in 2011, then 2021, and then what we expect in 2035. And you see that you have these 3 groups, which are the health professionals, health associate professionals, and personal care workers being the most important ones. But you also see from those, let's say, less important ones that there is some increase predicted for the future, and I will quickly speak about that. So, of course, health professionals, these are doctors in nursing homes, which provide emergency response, overseeing care plans, prescribing medications, but also nurses who administer medications and monitor the patients and coordinate the care, but also increasing importance of dietitians and nutritionists. For health associate professionals, these are various occupations ranging from, let's say, medical records and health information technicians to physiotherapists and community health workers, and then the care workers themselves that help either with essential activities like eating and washing, with instrumental activities like cooking and chopping, but also provide a range of other services. It is important to mention that almost 90% of the paid care workers are women. This category involves also childcare workers, but the share of adult to childcare workers is approximately 2:1. So this is what we see in the data. And then we have some supporting jobs that are going to be increasing in importance, like the category, which is kind of very broad in the occupational classification, legal and social area, which from our perspective, the most important ones are the social work professionals, but also psychologists. So I was talking about the future challenge for the jobs and skills in the care sector. I mentioned aging as a challenge from, let's say, the prospective number of people who will need care services, but there is also a second part to it, which is that the workers in the long-term care sector are aging too, and they will be retiring in large numbers. And then the question is, who is going to replace them? So CEDEFOP basically divides the future need for workers in different occupations into two parts. You have the new job openings, meaning that the occupations are increasing in numbers, and this is the orange part of the graph that you see. But then you have the replacement demand, which are people who leave the jobs and needs to be replaced by someone else because of various reasons. Mainly they retire, but they can also go to parental leave, they move out of the sector to work elsewhere, and so on. And you see that this replacement demand is much bigger than the new job openings. So if you put together the new job openings and this replacement demand, you see that from every 10 workers in the care sector, 6 will need to be replaced in the future. And this is a huge challenge. I also provide some information by countries. Basically, on this rather complicated chart, you see that on the vertical line, this is the share of newly created jobs measured as a relation to their current employment. So basically, countries that are higher in this chart are countries where CEDEFOP forecast expects higher new job creation for care workers and also medical workers. So countries like Romania or Poland, but also Czechia, Portugal, Austria, Greece, this is where new jobs are going to be created in large numbers in medical and care occupations. And on the right side, on the horizontal line, you have this expected need to replace old workers. We measure it as a share of workers who were already older than 50 in 2021. So countries like Italy, Latvia, Lithuania, and Bulgaria will have the highest replacement need. And the graph works that the farther you are from the beginning of the chart, the bigger the difficulties. So you have these countries that they have either high expected employment growth in the medical and care occupations and the countries with the highest expected replacement needs. And these countries will probably have the biggest challenge to find enough workers for ever increasing demand in the care and long-term care sectors. This is also because the care sector faces some hiring challenges. First of all, it's physically and emotionally strenuous work, which is not adequately paid. It is also one of the least regulated areas of work. There is lower worker protection, substantial undeclared work, and workers are reporting low job satisfaction and also higher exposure to precarious contracts, meaning that a lot of them have only part-time or temporary contracts, as you see in the chart, but many of them also say that they would prefer some other type of contract, meaning that they are, for example, involuntarily employed part-time, and they cannot do anything about that. So from the vocational education and training perspective, the general nursing programs are not sufficiently adapted to the care needs of the elderly, and also many countries do not require specific training for personal care workers, and this needs to change. To sum it up, both personal and medical care jobs are on shortage lists in most EU countries. So we see some way out of the situation, and we see that as an important actor to play a role in supporting the care sector, which should focus on work placement and apprenticeships, and then on partnerships for skills upgrade, preferably on regional and local levels. curricular updates based on high quality skills intelligence to understand what is really needed across regions and local levels for the care sector needs, and then work more on adjusting the learning to workers' needs, which include things like module learning, languages for foreign workers, and so on. Most of the information that I told you is summed up with this in this policy brief handling change with care, which you will get the link, and I will also share it with the chat. I think I already exceeding my time, at least compared to the agenda, so I will stop here. Thank you very much for your attention. There is a questions and answer session in the end, but please write me also in the chat, and I'll be monitoring the chat and answering the questions that you might have. Thank you very much for your attention.
Thank you very much, Jiri. Thank you very much. Have we got any questions on the chat, Anna?
No, we don't have any questions.
No questions?
No questions.
Well, just a reflection that came to my head when Jiri was explaining and giving us all this data, is that by the time we are 70 or 80, the prospects aren't very promising, unless we move to Finland or Norway. Yeah. So, are you optimistic about by the time we are old, all the people here today, by the time we are old people, are you optimistic about the conditions that we're going to be, facing if we need help?
No.
Oh, God.
When you already look at unemployment levels, which are super low, across almost every European country, you see that the talent pool is kind of drying, and because of the aging of the population, this is only to get worse. And then you have the issues that people that are choosing, young people that are choosing their future careers, they have to decide. And unfortunately, to work in medical and care, sectors is not something terribly appealing. And also, it is an outcome of the unfortunate developments during the COVID pandemic, which exposed a lot of difficulties that the care sector is facing. So definitely, there has to be more work done on promoting the work and let's say alleviating the work conditions that are not very good in many cases. But the only one way out of the problem with skill shortage is let's say more involvement of technologies. You have the care robots in Japan. I'm not really sure if this is a way that we will be able to follow very soon. And then migration, but also migration has other issues. It's very often a topic that is not viewed well by many politicians and significant part of the population. But these are basically the options, and there is little else that we can do.
Yeah, actually, you mentioned immigration, and at least from what I know in here in Catalonia, a lot of workers in the case of elderly homes are immigrants. Unfortunately, obviously, it's what you say. It's a job or a sector that is not appealing for young people, older people, and obviously it's like these jobs that like local nationals don't want to do. Obviously they're there free for the immigrants, which probably is not the best solution for everyone. So yeah, we'll have to see how things evolve in the future.
Yeah, one last point is that the challenge is really different from Western and let's say Eastern Europe perspective. And I'm from Czechia, and many care workers went to work to Germany because even if the pay is not great for German standards, it's really good for Czech standards. And that's why we have a significant shortage, and Western countries can tap on the pool from Eastern Europe, which is easier also from the work permits recognition perspective. And in Czechia, we have a huge amount of Ukrainian care workers because this is the situation that is a solution that is available to us. And you see basically the same developments when you compare other Eastern and Western European countries, and also possibly with Southern European countries.
Yeah, very interesting. Yeah, well, as you can see, we've got a lot of food for thought here. That's from the first presentation. So
Thank you.
thank
And
you
I'm really
again.
excited to hear the region examples and to learn what is really happening down on the ground. Thank you.
Yeah, great. Thank you very much, Jiri. And now we will carry on as scheduled. And our first speaker comes from France. Her name is Céline Blanc, and she's the Director of Guidance and Training Policy at the region of Centre Val de Loire. So, Céline, we're ready when you're ready. Thank you very much. And bonjour.
Bonjour. Yes, I'm going to share my presentation. Hello. First of all, it's my first English presentation, so be indulgent. I'm Céline Blanc, and I am the head of the Social and Care Training Department in the Région Centre-Val de Loire, and I'll give you some details further. The aim of my presentation is to share the strategy we are working on regarding the health and social training sector. Especially, I would propose to present an experience of an employment and training analysis. We did it to check if we train enough people, students and job seekers, in healthcare professionals, and if the recruitment needs of hospitals or care home are met. I divide my presentation into four points. First, some information about the Région Centre-Val de Loire and the health and the social sector, and a few words about the training and employment strategy we are working on. And
Céline, sorry,
yes.
Céline, are you projecting your presentation, because we can't see anything?
You can.
Sorry about that.
I am correct. I correct this.
Is that the case with everyone?
It got yeah. Maybe we try again.
Yes. Sorry. Is it okay for you?
Attendez.
No.
Because
I see your name and your region's name, but the screen is black.
Okay. Anna, you can Alicia,
I can. No worries, yes.
You can show it.
And you tell me.
Yes,
it's
the slide 2. Yes.
Yeah.
Yes. Next, it's okay. Okay. It's okay. Yes, okay. It's the presentation of my agenda with the 4 points I was presented. Next slide is, as I said, I work for the Région Centre-Val de Loire, which is the French local administration, and as you can see, a French mainland territory is divided into 13 regions. In the slide, you can see the main characteristic of this territory in terms of population, and for example, I can tell you the main responsibilities of the regions, which are regional economic development, intercity school transport, or professional training for job seekers, and obviously care and social training. Next, please. Now it's a focus of social and healthcare training in my region, and this training sector represents 17 training schools in social and care sector. They provide this training, provide session, provide different jobs like nurse, physiotherapist, midwife, ambulance drivers, and care assistants. All in all, it represents 12 different types of care training and 6 different types of social training. We welcome and we train 8,600 students. The role of the region for social and healthcare training is to finance schools in order to make training sessions free for students and or unemployed people. Some of the students can have a scholarship paid by the region too, and the region is also in charge of equipments, mostly digital, and teaching materials. You can, next slide, please. To this point, in this on this slide, it's to make a photography of training and employment strategy for the social healthcare sector. First, the main issues, like most European countries, French population is aging and demand for care needs is growing. In Région Centre-Val de Loire, the situation is worrying because a lot of people can't easily find care professionals. Especially in the south of the region, where there are most rural areas. Other main issues are obviously reduction in the career length of professional and so on, like is it written. You can make a click, please. Yes, and the objective, considering its responsibilities in care training, the Région Centre-Val de Loire decided to carry out an analysis of care employment and training. It aims to understand if the number of care training places are sufficient enough relative to the care recruitment needs. And the result, you can click, please. It's during the past year, we, with the help of an employment training observatory, we analyzed 18 care and social training sectors. And to do this, we also organized meetings and webinars with representatives of the professions to share knowledge and data. Yes, it's some illustrations. These two visuals represent illustrations of training needs over the next few years, compared with the places in training we have. One visual is for nurse training, and the other is for social worker training, because it is the both we are working on. You can click 3 times yes, and it's okay. Thank you. No, yeah. Without going into details, this graph represents different information. The bar chart, in purple, describe number of places in training. It's an estimation based on what we know now. In green, it represents graduation rates. By graduation rates, I mean the difference between people who started the training session and those who really graduate. And we can know there is a difference, and we are trying to work on this situation. In red, in the graph, with the graph red, we have projection of recruitment needs. It's a forecast for the next 10 years made from an analysis of employment dynamics observed over the last 10 years. This tool is a decision support to define if we have to increase or to reduce the number of places in trainings. Next slide, please. And as we know, care training is an essential answer to the care sector recruitment difficulties, but the situation is so serious that care training only is not sufficient. So we try to enable a range of responses to meet recruitment needs, such as improving the graduation rate, working with employers on quality of life at work, and also improving the attractiveness of training. Right now, we try to improve quality of business internship. Reception of trainees represent 50% of the duration of training. So when reception of internship is a bad experience for students, they don't want to stay with the employer and ever in training anymore. To avoid that, we have to work with representatives of professions, and we are going to do that. At last, reducing training dropouts, it's also one of the objectives. We have to work with care training schools for that. Currently, only 75% of students who start a nurse training will graduate. So they were more than 80% in 2020. In summary, we try to activate all these levels to make the care profession the care profession more attractive. And to finish my presentation, I'd like to quote a partner who used to say, we have to pay attention to care training because those who are trained today will be those who will care for us tomorrow. So thank you for your attention.
Merci beaucoup, Celine. Well, I'm sure we couldn't tell it was your first presentation in English, so that was good. Yeah. Have we got any questions, Anna, on the chat for Celine?
For Celine, no questions.
No questions?
No.
Okay, so from what we heard from your presentation, we have a problem that has already been mentioned so far, which is like there's a big gap between
Yes.
the demands of the care sector workers and what we can offer, what the workers we can produce. So I'm going to ask a similar question that I asked Jiri before. Are you optimistic about the future? Do you think these objectives, it was in one of your last slides, like these measures you are taking to improve the situation, are you optimistic that these measures are going to work and you're going to find like a solution for the needs that you are facing now?
I want to be optimistic because it's necessary to mobilize every answers, every levers we have identified, but I'm not sure all these levels will work because it's the situation is really worrying. I think so. We try to do this, but I hope we'll succeed. But voilà, it's a real worrying situation because I think youngers really want to work in this in care and medical sector because these jobs are make sense for this, but the working condition is these working conditions present too much difficulties, and the situation prevent them to go on their studies.
I just want to, Oscar,
Yes.
as Celine has said in the presentation, I just want to point out that the training system is not the only answer. That maybe we have to take into account that we have to start changing employment policies as well, because it's always all the effort like in the schools and training centers and whatever. And I think that maybe we have to point out that, no? Maybe as well.
Yes, with this work, we wanted to analyze the contribution of training system, but we know that it is not the only answer to mobilize. It was to replace the training at the just place in all solutions we have to mobilize.
Thank you. I think there's a question by Samantha.
Yes, this is a question. Yeah. Celine, Samantha asked if you have plans to achieve the improvement in graduation rate.
We try to mobilize training schools because we thought we have to mieux accompagner, to enforce the way the training is the way students have been better support to achieve their training, and the other preoccupation and is, as I said, is the quality of business internship, because mostly most students stop their training when they because the reception of training is not the quality of the reception training is not sufficient, and is so bad. There are reasons for this. As we said, the working condition, low job satisfaction. There are some reasons, but the fact is reception trainees is create some stops of training.
Thank you, Celine. Okay, so we'll go on to our next speaker. Now we're going to Italy. So we say buongiorno to Lucia Pederiva. Lucia she works at the Bruno Kessler Foundation, and she's a member of the Trentinos project team at UVEC, in the UVEC project, which she'll explain later on what this project is about. So Lucia, ready when you're ready. Here.
Good morning, everyone. Let me share my screen first. So here we go. Do you see the presentation?
Yes.
Okay, good. So let me tell you first something about our region. So first, something about myself. So I'm Lucia Pederiva. I work at the Bruno Kistler Foundation, particularly in the Digital Health and Wellbeing Center, and which is based in Trentino, which is a small region in the north of Italy with a population of more than a little more than 500,000 people. And because of the geography of our territory, which is mainly mountains, we are organized with one big health trust that deals with the entire region with more than 8,000 workers. And as you can see from the numbers, we have a little more professional per 1,000 inhabitants compared to Italy in general. So as Jiri mentioned in the first presentation, there are some main challenges for the healthcare sector ahead of us. He mentioned the aging population, but let me add something about other trends that we're going to face in the future. So the increase of chronic diseases and comorbidity, because more and more people are now affected by chronic diseases and such as diabetes and cardiovascular diseases. And this means that people will need to be followed for a larger part of their lives. And so we will need to engage, to actively engage patients to take responsibility and self-monitor themselves and continuously communicate with healthcare professionals. As we mentioned before, there is going to be a shortage of healthcare professionals, so we need to engage patients to do their part too. Then we have the trend of the digitalization of society. So we have the digital transformation is now reshaping our healthcare sector too. So telemedicine, the use of big data, of artificial intelligence will have some impact and benefits, let's hope, on the healthcare sector too. Then we have personalized care and prevention. So we are going to see more and more the use of a care that is tailored on the need of each patient. So with, for example, genetic engineering, biotechnologies, and new discoveries that will make sure that personalized care and prevention is carried out in the future. Then we have the modern health consumer. With this, we mean the fact that now patients have a growing access to health information and tend to be more informed compared to the past. And they need to be sometimes also involved in some decision making about their own health. They expect high quality of care and cure, let's say. And then, of course, there is the climate role. We know Europe is very much concerned with the climate challenge of the future. So we need to make sure that also our healthcare sectors are sustainable, and we consider the impact of health on the environment. To make sure they are sustainable and not only financially, but also that we take into consideration the climate. So in the VECA project, I will present to you briefly later. We asked to all our partners and to the professionals and students what they feel about the skills that they need to foster in the future. So what actually we noticed here is that this is the data you see is actually based on the local answers that we received from healthcare professionals and students. So they evaluated the importance of each skill that you see in the table, and then what they feel is their performance in this particular skill, and if they would be ready to participate in some training to increase their capabilities. So we see that actually they evaluate communication as the most important skill for their professional. But then when we look at the current performance, they're not actually, this is not the best, let's say, skill that they feel they're using. So so we see a higher number, higher current performance in collaboration, but then when we see the likelihood to attend training, we see that people are also very much concerned with leadership skills in healthcare. So this was a scale from 1 to 7. In general, we see that people are they're very concerned with all of these skills, but then some of them are may be more interesting than others for our professionals. But then they're nice numbers that actually tell us that training is needed and people are willing to engage in these kind of trainings. When we in the Bruno Kessler Foundation, we focus on digital skills, and these are some numbers that focus on the digital skills in Italy in general. Italy was involved in a technical support instrument from the European Commission on digital skills. And this is what actually came out from this project, which actually shows that we need to increase the digital scenario, and because there are a lot of differences among regions, and still we need to make that jump in digital skills. Let me talk to you briefly about the Eureka project. That is what we are now engaged in Trentino, and what we're trying to bring out to increase the skills for the healthcare sector. So it's an Erasmus Plus project that is focused on vocational training in healthcare. So it is designed to support the need of innovation and development of skills in the healthcare sector. What we plan is to create in each of the 7 regions participating in this project 7 regional hubs that will collaborate on a European platform to ensure the coordination and innovation and the upward convergence between different regions in Europe. And what we will also like to do is to promote also mobility, both physical and on a virtual level, of learning and collaboration among regions. So what we will do during this project is to create different training activities that will then be launched on a platform on the web in which healthcare professionals and students will be able to participate and attend courses both from their local region and from regions in different regions from Europe. First in the regions participating in the project, but who knows, in the future it would be nice to have nice experiences and sharing of training among all the countries in Europe. So what I talked to you about earlier, so the analysis of the skills that were needed in the and that we were supposed to focus in the project was part of the first part of the project that we brought forward in the last year. And now what we're focusing on is the creating of the hubs and the activities on the platform that we're still developing. And we will test in the fall of this year. So the creation of the hub, in particular in our region, was designed to include all the actors that are actually engaged in training in our region. So we want to create a place and a space where all these actors, such as educational institutions, health providers, the policy makers, and social partners, and such as small entities that actually do some training on the at local level, where everyone actually sits in one place and they talk about what is going to be the future of the professionals and what are the training needed at regional level, but then what we can bring from outside in order to have some exchange on the future that we imagine for our sector, and to ensure that we are all on the same page, and then there is a sharing of experiences. So I don't know what. Okay, if I would stop here, and if there are some questions, please. And thank you so much.
Very much. Thank you very much, Lucia. Anna, have we got any questions for her?
No questions in the chat.
Questions.
Oscar, no.
Well, I've got one.
Oh, sure.
Yeah. Well, more than a question, a comment, or I don't know. Because it has been mentioned before that maybe one of the possible solutions for this need of care sector workers is the vet system, but not only, obviously. And I'm particularly interested in this project that you talked about, UVECA, because it's a center of vocational excellence, and actually the regional Ministry of Education in Catalonia is participating in 2 centers of vocational excellence. And obviously a center of vocational excellence, as you explained, is an ecosystem. It's like a network of relationships between different kinds of institutions. And here we would have like vet schools, for example, chambers of commerce, companies, and other institutions. So do you think that could be like a better solution for this crisis in the care sector?
For sure, I think the idea of having more institutions, more entities that actually work together and are collaborating to think about what we need in the future of our professionals is for sure the answer to better face the challenges in the future.
Great, thank you. Okay.
I have a question, Oscar.
Yes,
sorry.
yes.
Because we were discussing that one of the problems, let's say, is also the quality of training. Celine was mentioning that. So I'm wondering if in UVECA you are also sitting with the like the work placement with the people in business to talk to them about the project and what you are doing. So the quality of training in place is improved as well. If you are planning or you are under discussion on this.
We're still planning the training activities, and we're trying to engage professionals that can deliver high quality training also on the platform. We will have for sure a phase in which we're going to make sure that the training activities that we are trying to organize are of course, of high quality, based on the feedback that we will receive from external partners. And but then, yes, we're still talking about that.
Okay, thank you. Right, so let's carry on. And now we move to the north of Europe, and we welcome Anna Fallesen. Anna Fallesen is the head of the elderly care at the region Västra Götaland. So we say God morgon, Anna. Anna, are you here?
I was impressed. I said good morning, but in Swedish, god morgon, god morgon.
Okay, sorry. Thank you. I wasn't sure about the pronunciation.
It was good enough, I'm sure.
Thank you.
Thank you for the presentation.
So Anna, we're ready to listen to you. Thank you.
Yes. Well, thank you, Lucia, for an interesting presentation. My name is, yes, you can take this picture, Alicia. Thank you. My name is Anna Fallesen, and I'm head of elderly care in a small town in Sweden called Svenljunga. Svenljunga only has 11,000 inhabitants, to compare with the closest larger town called Borås, which is the 16th largest town in Sweden that has 115,000 inhabitants. Both these cities are quite near the second largest town in Sweden called Gothenburg, with 500,000 inhabitants. The challenges we face, not only in Svenljunga, but in all of Sweden, and as you have said, all of you before, we all sit in the same boat and have the same problems. Foremost, personnel, caretakers, and educational. We have not enough labor, and we have not enough educated labor. At the same time, as you all witness, the elderly population is rapidly increasing, and they are getting both older and sicker. You can take the next picture, Alicia. Thank you. They're getting older and sicker. Multi-diseases and advanced technical equipment are more and more common. As you see in this picture, from 2021 to 2031, we see that the elderly people will increase with almost 50%, and the people in working ages 20 to 66 will only increase 4%. So there is a big difference, and we have to do something about that. You can take the next picture. Add to that, next year we have a new law implying us to work with our elderly more proactive, more including in the society, and health promoting by using digitalization and as a work method. These new rules will require that our workers, our care workers, have the ability to use and assist with the new digital future. Young people do not choose to educate themselves in favor for the social sector. And in Svenljunga, we also struggle with the fact that the younger generation do not have a tradition of further education at all. They are unemployed, or they move away to bigger cities. We also have quite many newly arrived people who also are unemployed because they cannot speak the language. Both these groups also get some kind of welfare from the municipality, which makes it difficult to succeed with our financial results. We have deficiency in caretakers, assistant nurses, and case managers, legal professions. the tremendous competition between the municipalities close by also lead to higher salaries, and a small town as Svenljunga is, we cannot afford to keep up. And as if this were not enough, a large amount of the personnel we do have are quite old and are about to retire in a near future. And as you can imagine, they are not so keen on the new part in the new law that requires digitalization as a working method. To address these problems, we were forced to think and act and work in a different manner than before. First and foremost, we needed to get the unemployed people in the community ready to come to work with us in the municipality. It's about 6% that are unemployed in Svenljunga. And we had to differentiate the work tasks so that these uneducated people could start doing tasks at a lower level and then offer them education at the same time, both the working skills and in the language. We recently started a project that we called Inclusive Work Life, and here we offered the participant, we offer them a job with work experience and a salary during the whole time, and education of maximum 3 years. And over time, with this method, we have increased both the numbers of personnel, the caretakers, and their educational level. And we trust that some of these people also continue their education to higher levels. It's very clear that we need these people, and most of all, we need the young people. Most of them have superior skills in the digital environment. Compare with, for example, myself, I'm 55 years old. They handle the digitalization with such ease, and they do not compare with how it used to be, which makes them more able to see solutions that, for example, I don't. Our task is, though, to make this requirement known among the young people, and hopefully then they will see these kind of professions as more attractive in the future. Additional to this, we are building a foundation of volunteers to help with some of the tasks that including the elderly in the society, because as I think it was Jiri that mentioned, no, it was Oscar that mentioned the Corona period in our lives. The elderly were not included in the society. They were left on their own, and that I think I can speak for all of us was great problems for those who were 70 years and older, and we are looking at those problems now. So we have to really work to get them included in the society again. Well, actually, that was all I was going to say.
Okay, thank you, Anna. So now we go to Catalan Anna to see if there are any questions on the chat.
No questions.
No questions on the chat.
No.
But Anna, you mentioned you've been the only one, catching the question I asked at the very beginning about the pandemic and the coronavirus, and so maybe I'll take the advantage that you did that and say, is your region or Sweden in general, are you prepared for the next pandemic? whatever it is?
I think for now we are fully prepared, but if we wait a couple of years, I'm not so sure.
How come is that?
It's still fresh in our memory, and we still live by some of those rules, but we can already notice that some of the routines that we had during the corona is slacking. Yeah.
Okay, great. Thank you very much, Anna. And right, so if there aren't any more questions for Anna,
I have.
Yes, okay, Alicia, sorry, you your hand, sorry.
I have two questions. One question is, in the new Social Service Act, is including digitalization, but is including training in digitalization as well?
No.
No. Okay. Okay.
No, but if we are going to use all those, well, if we're going to work in a digital world, we have to prepare, and we can see that the care workers that we have today are not so skilled. So we have to include education in that. And if we're going to work in a digital manner, we also have to educate our elderly.
And a second question, in the project that you mentioned, Inclusiveness Work Life, how is finance? Is the municipality financing or?
Yes, half of it. We're doing it together with another municipality in the same area and in the same size, and we got half of the money from the region, and we have half of the money ourselves.
Okay. Yeah. Okay. Thank you, Anna.
Thank you.
Thank you, Alicia. Oh, sorry, just can I go very quickly? Can I go back to Lucia and ask her what Spanish region is involved in her cover? Is it Valencia, probably, or I don't know if Lucia...
It is Valencia.
Valencia, okay.
It is Valencia.
Yeah, great, thank you. Right, so it's time for our last speaker today. So we travel further south to Germany, and we welcome Andrea Bernert Bürkel. And guten Tag, Andrea. And she's a specialist for the EU project counseling and young adult education centers at her region, which is Baden-Württemberg. So Andrea, yeah, we're ready to listen to you when you're ready. Thank you.
Yes, thank you so much for having the opportunity. I'm actually from Baden-Württemberg in the southwest of Germany, a rather big region with 11 million inhabitants. And as you heard just before, I'm from the adult education, not only young adults, but adult education centers in general here in the region, Volkshochschulen, VHS. I'm dealing with a lot of projects in the field of migration, and that is actually the field that I will present today. We heard already before that migration is one of the options to tackle the shortage of skilled workers in the care sector, and this is actually a strategy that is very much followed in Germany and also in our region in Baden-Württemberg. I'll try to share my screen because it's not activated, Alicia, so maybe, you can share the presentation as you like, or you have to activate that I can start the screen sharing as you like it.
Now you can share your screen, Andrea.
Okay. So, there we go. Okay. Yes, actually, I will talk about a project in our region, which is run in a small municipality, which is called Heidenheim. It's a municipality with 50,000 inhabitants, and maybe those of you who follow football saw that they have a Bundesliga team now and just lately bet Bayern München. So we are proud of this rather small city. And the project I'm going to talk about is just an example. So we have similar projects in a lot of places here in our region in Baden-Württemberg with our 160 schools, the Adult Education Centers, VHS. The project I'm presenting today is a cooperation with 3 elderly homes from this municipality. So elderly homes running by the German Red Cross. That's why you see the German Red Cross logo here. So they are running a lot of institutions in the care sector. So among others, 3 elderly homes. And I'm going to talk about migration. And if we talk about migration and people filling the shortage or people working in elderly homes, then of course we have to talk about language. And the project I'm presenting today is on the one hand a project that supports German language training for people who came from other countries to Baden-Württemberg to work in the care sector. And it's a specific concept that not only helps that people learn the language, but it is very closely linked to things, to the work in elderly homes. So I think it's a good example on how one can combine the 2 aspects. Maybe on the background, as I said, migration in Germany, that's one of the strategies to fight the shortage of skilled workers. And if we talk about people migrating to Germany for work, we actually have to talk about different groups. And in the care sector, this is especially relevant in Germany because we are not only looking for people who could generally work in helper or assistant jobs, but we are also looking for people who can fill skilled jobs. And in the case of Germany, skilled care sector jobs are so-called restricted jobs. So you need specific qualifications in order to be allowed to work here. And if we talk about immigrants working in the sector, we are talking on the one hand on EU immigrants who, if they have a qualification, care sector qualification from their home countries, who can use that in Germany without any specific training if it comes to vocational skills. But they also need to have language skills. And we are also talking about third country persons who might bring a qualification with them, but have to do some additional trainings here in order to be allowed to work. And of course, we are talking about immigrants without a relevant qualification who then have the challenge to do a vocational training in Germany and at the same time language training. All groups that would like to work in skilled jobs in the care sector, and skilled jobs also always means well-paid jobs. That's a problem because we have a lot of helper jobs, but with very low levels of earnings. So those who want to work in skilled jobs, they need at least a B2 level of language skills, which is, as you can imagine, pretty high and a big challenge for many people, especially, for example, in the nursing sector. So that is where we come in as schools, because as adult education centers, we offer some vocational training as well, but a very big share of our activities is German as a foreign language training. Here in this field, in this project that I want to present, we didn't only organize language training, language classes, language workshops. And this is actually the special thing about the project I would like to present. We offered language workshops, so normal language training in a class with a German teacher, but we combined this with 2 things. So the one thing is that we added an element that we call language coaching. And this language coaching is actually carried out usually by the language teacher who is going to the workplace very individually looks with the people who work in these 3 elderly homes what challenges they have at their workplace language-wise. And then the language training uses these authentic situations, these authentic fields of communication, these authentic specific words you have to know and things like that. And the teacher brings this back to the classroom. But there's a third thing which we find very important, and that is an element we call language mentoring. And this language mentoring is done by people that work in the elderly homes, our 3 elderly homes, that have or they work there, they have the skills they need for the work itself, and they get trained and learn how they can use or how they can support also the language training or the language acquisition of the newly arrived people working here. So these colleagues have an important role, not only that they learn some strategies how they can teach, how they can support language, how they can create a language-friendly workplace. That's important, but also how they can, for example, prepare some instructions on work processes, write down communication things, put words to all or the workplace, so that the workplace is on the one hand language friendly, and also this is a big advantage also for the working processes themselves. If processes are documented and written, if communication is written down so that everybody knows how do we communicate with the elderly people, for example. So we see a big advantage in this combination. And very quickly, I go through some more slides, but really very just very briefly. So these language workshops, actually, they took place once a week. You see on Friday early afternoons. So that many people could participate, that many migrants that work in these elderly homes. So this program is basically addressing people who already work in elderly homes but do not have sufficient language skills. And the typical participant actually was already following a vocational education and training, so migrants coming to Germany. So either following a vocational education and training, so people without a relevant qualification from their home countries who do a language training here. And the other big group was people who are in so-called recognition procedures, so that their qualification they brought from their home country was recognized here. And then in these procedures, they have to prove this B2 level of German, as I mentioned. And then we had the staff from elderly homes working as mentors. And I already mentioned that for us, it was very important that we did not only teach job-related German here, but at the same time, people could get skills concerning the work itself, so vocational skills. I already mentioned this, and Alicia, I think we already ran a little bit out of time, so I think I can skip the slides and just mention that, of course, we didn't only have this coaching and mentoring, but we also had an online learning environment with a lot of material on it. I want to mention that audio and video-based learning was also a very important tool we used here. Again, individually produced at the workplace, so that at the same time you had language on these videos, but also vocational processes or professional processes, photos, other authentic material, and the training was very individualized, so everybody had his or her own portfolio and could learn with that once. Yes, last thing, just very last thing to mention is that we have a big national program in this field of integrating migrants into the care sector or in all restricted work sectors actually in Germany, which is called integration through qualification, offering support with recognizing foreign exams, and also offering some training. So in case your home training is lacking some skills, then through this program we can offer upskilling or additional skills training for this. Okay, that's it. I stop sharing my slides. Yeah, and
Thank you very much,
I'm here
Andrea.
for
Thank you very
questions.
much. Have we got any questions for Andrea, Anna?
Yes. Sorry. We have two questions for Andrea. The first one is, from which countries your future migrant workers usually come from?
Actually, I have to say from all over the world. As somebody mentioned before, we had a lot of people coming from countries like Czech Republic, Poland to work in Germany in the care sector, also a lot in private households, I have to say. But this changes now. And having heard the presentation before, I can now imagine that actually a lot of staff is needed in these European countries as well. So now from all over the world, we try to bring, for example, a lot of Ukrainian refugees and other people who already migrate to Germany into this field. But there are also campaigns in countries, for example, like the Philippines. So really countries far away, or Vietnamese people are also here. So there are some official campaigns from Germany, I have to say, to attract people. And also in this type of trainings, we had a lot of people from Philippines, for example. I met them, a lot of them, yeah.
Okay, and next question. How successful are you in retaining these workers? They usually stay permanently longer or they leave?
If they leave the jobs again, I would say it is stable in these projects we had here, because we addressed people who try to qualify for skilled jobs. And of course, if you went through a qualification of 2-3 years through a recognition process with these people, the experience is that they stay. But I understand the question, because we have a lot of people who work in assistant jobs, and there we see a lot of mobility. So people start maybe here and then they go back to their personal professional background. And that's why we, some of the people here around the table, know that I'm also, one thing is integration, and guidance is also a second field of activity of myself. So before we as schools or together with partners send people to a specific profession, we make sure that this is what they want. Or do we find a better pathway in their original professional qualification? Because the experience is you can waste a lot of money to train people for jobs they don't want to do, and they will move to other jobs. Yeah. But these things, these trainings we do with skilled persons. Yeah,
So
the probability that they stay is higher.
Yeah, that's the reason they stay, because you are training them for skilled and qualified jobs.
Yes.
Yeah. So that's
exactly.
the way you achieve to do that, to retain them. Yeah. That's it. No more questions, Oscar.
Okay, thank you, Anna, for your help with the chat. And yeah, before we just conclude this webinar, I'm just going to put on the chat some information about the film I mentioned at the very beginning. Here you can watch this webpage. You can watch the trailer, and then if you feel like it, maybe this weekend you can watch it with your family. Right. So we're getting to the end, and we just want to remind you our next webinar, which is going to be on the 11th of June on this case on the blue economy, because most of the regions in that are part of all have kilometers of coastline. So we thought it was a good idea. But obviously, those that have big rivers are also welcome to join in and give their opinion and insight on the blue economy. So, Alicia, I don't know if that's everything for today.
Yes, I think so. Thank you for moderating, for participating, for your questions. and hoping to see you in the next one if it's of your interest. We know that it's a different topic, but yeah, spread the word and we keep in touch. We will be sending the presentation and everything after, so we receive news from us soon.
Well, thanks to everyone for your presentations, for your attendance today, for listening, and see you soon. Bye.
Bye.
Bye. Thank you very much.